Would you like to know more about diabetes and how you can reduce your risk of getting diabetes? Then this is the video for you. Hi, I'm Laura, and I am a registered dietitian and a certified diabetes care and education specialist at Century Health. And today I'm here to talk to you about diabetes. So what is diabetes? Diabetes means you have too much sugar in your blood. The medical word for sugar is glucose, but it's just easier to say sugar, right? Your body changes most of the food you eat into sugar, or glucose, which then travels in your blood to all of the cells in your body. Your body makes a chemical known as insulin to help sugar move from the blood into your cells. Your cells need this sugar to give you energy and keep you healthy. There are a couple different types of diabetes. When you have diabetes, either your body doesn't make insulin, which is referred to as type 1, or your body doesn't make enough insulin, which is type 2. There's also gestational diabetes, which is experienced during pregnancy. Prediabetes is a serious health condition in which blood sugar levels are higher than normal, but they're not high enough yet to be diagnosed as type 2 diabetes. A person with prediabetes is at high risk of getting type 2 diabetes, heart disease, or stroke. Today, we'll just be talking about type 2 diabetes and ways to prevent and reduce your risk. Type 2 is the most common form of diabetes, and it means that your body doesn't use insulin properly. While some people can control their blood glucose levels with eating healthy and exercise, others may need medication or insulin to help manage it. So what impacts diabetes? Some people are at higher risk of having type 2 diabetes, including those who are overweight or obese, are age 45 or older, have a parent, brother, or sister with type 2 diabetes, and are physically inactive less than 3 times a week, had gestational diabetes, which is diabetes during pregnancy, or gave birth to a baby who weighed more than 9 pounds, or are African American, Hispanic, Latino, Asian American, American Indian, Alaska Native, Pacific Islander, or Asian American person. How do you know if you have diabetes? There are several ways to diagnose diabetes. Remember, testing should always be done in a healthcare setting, whether at your doctor's office or a lab. There are a couple different tests that help to diagnose diabetes. The hemoglobin A1C, often referred to as just A1C, or the blood glucose test. The blood glucose test provides a snapshot of your current glucose level. Normal ranges or low ranges include values 70 to 99. Moderate risk is about 100 to 125, whereas high risk is greater than 200. Another important test is the A1C test, which measures your average blood glucose for the last 3 months. Low risk is when your blood sugar and A1C number are less than 5.7. An A1C of 5.7 to 6.4 is a moderate risk, while greater than 6.5 indicates high risk for diabetes. Keeping your blood glucose levels within a normal range is very important. If your doctor determines that your blood glucose or your blood sugar level is very high, or if you have a classic symptom of high blood glucose, you may have diabetes. So what can you do to help prevent or reduce your risk of diabetes? A key part of preventing type 2 diabetes is maintaining a healthy lifestyle, which includes a healthy diet and managing your weight. This includes eating more whole foods and less processed foods, reducing your intake of high sugary foods, choose foods with less fat and more fiber, which is a great way to reduce your calories. Another good tip is staying on the outside perimeter of the store when you're grocery shopping. Eating smaller portions also help to reduce your calories that you eat each day. It also helps to lose weight. If you are overweight or obese, it's recommended to lose 5 to 7% of your starting body weight. Increasing your daily water intake instead of drinking sugar-sweetened beverages is another great way. Fitness is a key to preventing type 2 diabetes, which the good news is all you have to do is keep moving. Physical activity and fitness are a huge part of reducing your risk of type 2 diabetes. It's recommended to move more than 30 minutes at least 5 days a week. The key is to finding activities that you love to do and do them as often as possible. No matter how fit you are, a little activity every day can help put yourself in charge of your life. Other key ways to prevent diabetes: managing your stress, quit tobacco or nicotine products, getting adequate sleep, and getting regular health screenings. Staying on top of your levels is super important. Doing these things and reducing your risk means doing behaviors that minimize or prevent complications associated with prediabetes and diabetes. There are actions that you can take now, and they will benefit you years from now. You have the power to change your health outcomes.